the hypoglossal nerve, which is the 12th cranial nerve, and you are looking into the extrinsic muscles of the tongue, namely the hyoglossus, the styloglossus, and the genoglossus. It's the cut section of the medulla oblongata, and here you can see the motor nucleus of the hypoglossal nerve. That nucleus is placed in the floor of the fourth ventricle, just deep to the hypoglossal triangle, right? And another important thing here, you can observe that this nucleus receives corticonuclear fibers from both the cerebral hemispheres. And let me mark another important things, that there are let me show you the motor fiber coming downwards marked with the green. This supplies all of the muscles of your tongue, and you can see that there is the fibers again motor being shown in dashed lines. These are the fibers to supply the genoglossus muscle, right? And one thing should keep in mind, if you can concentrate here, see that the fibers that are coming towards the genoglossus muscle, they receive fibers from the contralateral hemisphere, right? That should be kept in mind regarding to the genoglossus muscle. Now you can see the anterior aspect or the base of the brain to show you the medulla oblongata, and here you can see that the rootlets of the hypoglossal nerve, they come out through the medulla oblongata in between the pyramids and the olives, so that they come out through the anterolateral sulcus, right? Now you can see that this hypoglossal nerve exiting through the medulla oblongata via rootlets and has to pass out of the skull through hypoglossal canal or condylar canal. Then what happens, that it has to come downwards to reach towards the lower part of the tongue, right? And what else is that, I have to show you that how this hypoglossal supplies tongue from below, hence the name hypoglossal, right? And you can see that it is going to supply all the extrinsic and intrinsic muscles of your tongue. Let me mark them. Now another important thing here, let me show you that in its upper part it receives fibers through C1 nerve that run in this hypoglossal nerve, and these are the fibers that are taking part in the formation of ansa cervicalis, right? Another very clear picture will demonstrate you the hypoglossal nerve, that how the C1 fibers are going to join this hypoglossal nerve, and finally they have to reach towards the muscles of the tongue, right? This Venn diagram is again a repeat of the motor nucleus of this hypoglossal nerve that receives bilateral cortical innervation, except the genoglossus muscle, which receives just contralateral fibers. Let me mark them, that these are the contralateral fibers for the motor fibers towards the genoglossus, right? So, can you read them aloud? That your hypoglossal nucleus has to receive corticonuclear fibers from both cerebral hemisphere for most of its muscles, except the genoglossus, which receives only contralateral supply from the cerebral hemispheres, right? Another diagram in repeat, that the hypoglossal nerve comes out from the medulla oblongata, passing through the hypoglossal canal, then runs under the tongue as a hypoglossal nerve, so supplies all of your extrinsic and intrinsic muscles. In the picture, the normal tongue you can see straightforward protruding out, but in the lower picture what happens, that your tongue is deviated towards the paralyzed half, right? Now what is the explanation? Let me show you that your tongue takes active part in the process of mastication and speech. So whenever tongue is paralyzed, it atrophies, and in case of low motor neuron lesion, what happens, you can see very well in the picture that this infranuclear lesion causes your tongue to be deviated towards the paralyzed side. So a sentence can be said that lick your wounds means your tongue is licking or deviating towards the paralyzed side in case of intranuclear lesion. But of course, if there is supranuclear lesion, what happens that your tongue deviates towards the opposite or healthy side, and in this case paralysis occurs but without the wasting of the tongue, right? Another good picture that shows that whenever there is infranuclear lesion, your tongue deviates towards the paralyzed side, right? So in repeat, you can see that your hypoglossal nerve is motor, passes through the hypoglossal canal when it has to exit through the skull, and when it is inside your medulla, it runs through the anterolateral sulcus and in between the olives and the pyramids. It has to exit in between both these structures. And finally, you can see so many rootlets. They combine to form the hypoglossal nerve, right? So how this hypoglossal nerve is gonna exit through the medulla oblongata. In between again, I have to mention the pyramids and the olives, and through the hypoglossal canal, and finally it receives fibers from the C1 nerve to reach towards the tongue, right? And let me show you the extrinsic and intrinsic muscle being supplied by the hypoglossal nerve from below. Okay.